What I'm about to walk you through is one of the most important skills a senior can learn without ever stepping into an emergency room, because a manual blood pressure reading, done correctly, can reveal the truth when a machine gives you a number you should never trust. And if you've ever looked at a reading and wondered, is this really my blood pressure or is something wrong here? This is the video you needed years ago. I'm Dr. Michael Joel, and today I'm going to show you exactly how to check blood pressure manually, step by step, in a way that is simple, calm, and accurate enough to change how you understand your heart forever. Please subscribe to this channel today and stay with me for simple, life-saving heart guidance made especially for seniors everywhere. Before we even touch a cuff or a stethoscope, I need you to understand why this matters. Because most people think a manual blood pressure reading is just the old-fashioned version of pushing a button. It is not. A manual reading tells you something deeper. It lets you hear the blood returning through the artery. It lets you catch details a machine may miss, and when it's done badly, it can fool you just as completely as a broken monitor. I've seen seniors in Phoenix, Tampa, Columbus, and Denver change medications, panic over bad numbers, or ignore dangerous symptoms simply because nobody ever showed them the right way to take a reading by hand. Let me tell you about Frank from Dayton, Ohio, because his story explains exactly what's at stake. Frank was 72, a retired mail carrier, steady hands, sharp mind, proud of doing things himself. His automatic cuff had started flashing error messages, then suddenly it spit out numbers that jumped all over the place. One morning it said 182 over 104. 10 minutes later it said 138 over 82. Frank didn't know what to believe, so his daughter drove him to urgent care, and the nurse took his pressure manually. It was 146 over 84. Elevated, yes, but not a crisis. And that difference completely changed what happened next. No ambulance, no panic, just clarity. That is the power of the manual method when you know what you're doing. But here is the part almost nobody explains in plain English. A manual blood pressure reading is not really about the gauge, it is not really about the cuff, and it is not even mostly about the stethoscope. It is about sequence. Order matters. Timing matters. Position matters. The sounds matter. The speed matters. If you rush one step, the whole reading can slide away from you before you even realize it. So by the end of this video, you are going to know how to do it in the exact order that gives you the best chance of hearing the truth. Now first, let's talk about what you need in front of you, because this is where many people already go wrong. You need a manual cuff, also called an aneroid sphygmomanometer, with a working gauge and inflation bulb. You need a stethoscope. You need a chair with back support. You need a table or firm surface to rest the arm on. You need a quiet room. And if you wear hearing aids, put them in and make sure they are working before you start. This is not the moment to guess. The manual method depends on hearing faint sounds. If the room is noisy, if the TV is on, if the dog is barking, your reading can drift. But equipment alone is not enough. Let me tell you about Patricia in Scottsdale, Arizona. Patricia bought a beautiful manual set online, watched half a tutorial, and thought she was ready. She sat down right after bringing in groceries from the garage in the summer heat, wrapped the cuff over her blouse sleeve, crossed her legs, and started pumping. Her reading was sky high. She was terrified. What Patricia measured, was not her resting blood pressure. She measured effort, heat, stress, and bad technique all at once. When we repeated it properly after rest, with the cuff on bare skin and her body supported, her numbers came down dramatically. The lesson is simple. Manual blood pressure is unforgiving of shortcuts. So step 1 is not the cuff. Step 1 is preparation. And this may be the most overlooked part of the entire process. You need to sit quietly for at least 5 minutes before the first reading. No walking around, no carrying laundry, no climbing stairs, no heated conversation, no coffee in the last 30 minutes, no cigarette, no recent exercise, and yes, Use the bathroom first. A full bladder can raise your reading. If you skip this stage, you are not measuring your baseline. You are measuring whatever your body is reacting to in that moment. Rest first. Breathe normally. Let the body settle enough that the number you get actually belongs to you. Step 2 is body position, and this is where physics starts interfering with medicine. Sit in a sturdy chair with your back supported. Keep both feet flat on the floor. Do not cross your legs. Do not dangle your feet. Rest the arm you are using on a table so the upper arm is roughly at heart level, which means about mid-chest height. Your palm can face upward, relaxed, and, do not hold your arm up with your own muscles. The moment your shoulder and upper arm tense, the reading can climb. This is one reason people get numbers at home that seem higher than the office. They are working to hold position instead of letting the arm rest. Now let's move to the cuff, because if this part is wrong, everything after it is built on sand. The cuff goes on the bare upper arm, not over clothing, not over a rolled sleeve, not half on the shoulder and half on the biceps. The lower edge of the cuff should sit about 1 inch above the bend of the elbow. Most cuffs have an artery marker or arrow. That marker should line up with the brachial artery, which runs along the inside of the upper arm near the elbow crease. Pull the cuff snug, but not brutal. You should be able to slide 2 fingertips under the top edge. If it pinches or slips, fix it before going on. And before I show you how to listen for the 2 sounds that matter most, I need to tell you about Earl from Tulsa, Oklahoma, because this is where beginners lose confidence. Earl thought the hardest part would be hearing the sounds. It wasn't. The hardest part was not knowing where to listen. He kept placing the stethoscope dead center under the cuff and hearing nothing but fabric rubbing and his own frustration. What he didn't realize was that the sound isn't everywhere. It's localized. It's over the brachial artery. Once we found that spot together, the whole process changed. Suddenly, the sounds were there. Not loud, not dramatic, but there, enough to trust. So here is step 3, and it is critical. Before you take the real reading, estimate the systolic pressure by palpation. That sounds technical, but I'm going to make it simple. Place 2 fingers over either the radial pulse at the wrist or the brachial pulse near the elbow. Inflate the cuff while feeling the pulse. Keep pumping until the pulse disappears. The number where it vanishes is your estimated systolic pressure. Then let all the air out completely. This matters because it tells you how high you need to inflate during the actual reading. And, if you skip this, you can miss the true top number, especially if there's an auscultatory gap, which is a brief silent zone. That silent zone has caused enormous confusion for people who thought they were doing everything right. Imagine hearing a first sound, then silence, then more sounds lower down. If you are inexperienced, you can mistake that silence for the real beginning or the real end and get the wrong number. That is why estimating the systolic first is so valuable. It gives you a map. Let's say the pulse disappeared at 140 while you were feeling it. On the real reading, you don't stop at 140. You go about 30 points higher to around 170 before you start listening on the way down. That way you know you began above the true pressure and won't miss the first sound. Now after you estimate the systolic by touch, wait about 30 to 60 seconds before doing the true reading. This part feels unnecessary to impatient people, but it matters. You have just squeezed the arm and interrupted blood flow for a moment. Give the artery time to recover. During that pause, set yourself up. Make sure the gauge is easy to see. If you're holding it in your hand, keep it still. If it's clipped or resting where you can read it clearly, even better. Put the stethoscope earpieces in so they angle slightly forward toward the tip of your nose. That little detail matters more than people realize. Backward earpieces reduce the sound. Now find the brachial artery again at the inside of the elbow. Place the chest piece of the stethoscope lightly over that spot, just below the edge of the cuff. Not underneath the entire cuff if you can avoid it. Lightly is the key word. If you press too hard, you can compress the artery and distort or erase the sound you are trying to hear. If you barely touch the skin and hear only room noise, adjust slightly. This is not a strength contest, it is a listening exercise. Once you hear where the sound should be, hold that position steady. Movement is your enemy now. The more you shift, the more sound you lose. Here comes the actual reading, and this is the moment people remember for years because it feels strangely dramatic the first time. Inflate the cuff briskly to about 30 millimeters of mercury above your estimated systolic pressure. If the pulse disappeared at 140, go to about 170. If it disappeared at 120, go to about 150. Don't creep up slowly. Inflate with purpose. Once you reach the target, stop pumping. Then turn the valve just enough to let the pressure fall slowly. And this is where accuracy lives or dies. The cuff should deflate at about 2 millimeters per second, not free-falling, not crawling. A slow, steady descent. Too fast and you'll skip the sound. Too slow and you'll distort the reading. As the pressure falls, you are listening for the first clear tapping sound, not the rubbing of your fingers, not the squeak of the cuff, not the pounding in your own ears. The first real pulse sound you hear is the systolic pressure, the top number, the moment that tapping begins. Look at the gauge and remember the number. Let me tell you about Linda in Jacksonville, Florida. Linda kept waiting for a loud, dramatic thump like in television medical shows. That's not what she got. She heard a soft, clean tap at 148 and ignored it, thinking the real sound would come later. It didn't, and that's how she kept underreading her systolic pressure. Once that first sound appears, keep releasing the air at the same slow speed. Do not get excited and dump the pressure. Do not freeze either. Just keep the same rhythm. The sounds may become louder, then softer, then change in quality. Eventually they disappear. The point where the sounds vanish is the diastolic pressure, the bottom number, for most adults. That final disappearance is what you record. So if you first heard tapping at 148 and the sounds disappeared at 82, the blood pressure is 148 over 82. And if the sounds seem to fade and then return, stay calm. Keep going steadily. The last consistent audible sound before true silence is usually what matters. Now, I want to pause here because this is where many seniors doubt themselves. They think, what if I didn't hear it right? What if I'm off by 10 points? That fear is normal. It does not mean you can't learn this. Let me tell you about George in Wichita, Kansas. George was 78, former Air Force mechanic, and he was ready to give up after 3 attempts. He kept saying, "I'm just not good at this." But the problem wasn't his ears. It was that he was releasing the valve too fast because he was nervous. Once we slowed him down, the sounds became obvious. Not easy, perhaps, but audible. Confidence in manual blood pressure comes from rhythm, not talent. There are 3 mistakes right here that destroy more readings than people realize. The first is deflating too fast. If the needle drops like a stone, your ears do not have time to match the sound to the number. The second is pressing the stethoscope too hard. That can create false silence. The third is talking, even a little. If you speak while taking the reading, your body shifts and the sound picture changes. And, yes, even saying, "I think I hear it now," can interfere. Silence helps. Stillness helps. Calm helps. A manual reading is almost like trying to hear a whisper across a quiet room. You do not improve that by adding noise. After you finish the reading, let the cuff deflate completely and write the numbers down immediately. Do not trust memory. Write the systolic over diastolic, the time, the date, and which arm you used. If you are monitoring regularly, note anything unusual, like headache, dizziness, missed medication, or emotional stress. Then wait about 1 minute and repeat the reading. This second number matters. Sometimes the first reading is a little higher simply because you were tense. The second reading is often calmer. And, if the 2 readings are close, that builds confidence. If they are very different, you may need a third reading or you may need to review your technique. Let me tell you about Sharon in Fort Worth, Texas, because her story shows why repeat readings matter so much. Sharon took one manual reading every evening and believed every single number without question. If it was high, she panicked. If it was low, she relaxed. But when we had her take 2 readings 1 minute apart, a pattern emerged. Her first reading often ran 8 to 12 points higher than the second. Nothing was wrong with her heart. She simply needed a moment to settle into the process. That changed everything. And this is why one reading should never become a verdict. A blood pressure check is information, not prophecy. The second reading gives the first one context. Now we need to talk about what the numbers mean, because a perfect technique is useless if you don't know when to act. One high reading does not automatically mean a disaster. Blood pressure rises with pain, anxiety, exertion, and poor technique, but repeated high readings do matter. In general, numbers consistently at or above 130/80 deserve a conversation with your clinician. Numbers at or above 180 systolic or 120 diastolic are more serious, especially if you have symptoms. And if you have chest pain, severe shortness of breath, sudden weakness, trouble speaking, confusion, or vision changes, do not sit at home perfecting your manual technique. Seek urgent medical help immediately. And I need to be very clear about one more thing. The manual method is powerful, but it is not ideal for every person. If your hearing is poor, if your vision makes the gauge hard to read, if your hands cannot squeeze the bulb well, or if you have severe tremor, this may not be your safest home method. There is no shame in that. Sometimes the best choice is a validated upper arm automatic monitor used correctly. But even if you never plan to do manual readings alone, understanding this process helps you understand what nurses and doctors are doing, and it helps you recognize when a number might be wrong because the technique was wrong. Now, let's go deeper into the part that separates a decent manual reading from a truly solid one. Consistency. Use the same arm each time unless your clinician told you otherwise. Sit in the same chair if possible. Measure at similar times, such as before breakfast or before dinner when your routine is stable. Use the bathroom first. Keep the room quiet. Keep the arm supported. Keep the cuff directly on the skin. And, do not decide halfway through that you would rather try the wrist or switch to the other arm because it feels easier. Consistency turns scattered numbers into useful data. Inconsistent technique turns a notebook full of readings into medical noise. Let me tell you about Walter in St. Louis, Missouri, because his mistake is one I see over and over again. Walter learned the basic manual method pretty quickly, but every evening he sat in his recliner, let his arm hang low by his side, and took the reading there because it was comfortable. His numbers were always higher at night, and he thought his medication was failing after dinner. It wasn't. Gravity was altering the reading because his arm was below heart level. Once he used a side table and a pillow to bring the cuff to chest level, the mystery disappeared. Comfort matters, yes, but not more than position. When the arm drops, the numbers climb. Another very common problem is the sleeve mistake, and it sounds small until you see the consequences. Do not tuck the cuff under a rolled-up long sleeve that is squeezing the upper arm. Do not place the cuff over a thin shirt and tell yourself it's probably close enough. Close enough is not good enough here. Tight fabric changes pressure in the arm, and cloth between the cuff and skin interferes with the measurement. I have seen seniors in Sacramento and Nashville change their whole week because of a reading taken over clothing. And the tragedy is that it felt official because it came from a gauge. A gauge cannot rescue bad placement. Only technique can. There is another mistake people make when they first start learning, and it happens right after they hear the first sound. They get excited, glance away from the gauge, or lose track of the number because they are so focused on listening. If that happens to you, slow down and practice. Some people find it easier to say the number softly in their head as they hear the sound: 148, 146, 144. Others prefer to watch the needle in a relaxed way and trust the ear to catch the beat. Either way, do not rush the learning curve. Manual blood pressure is a skill. Skills improve with repetition, not with self-criticism. Now, a question I often hear from seniors is this: can I take my own blood pressure manually, or do I need another person? The honest answer is yes, some people can do it on themselves, but it is harder. You must keep the arm relaxed, see the gauge, control the bulb, and hear the sounds all at the same time. That is a lot. If you have a spouse, family member, friend, or caregiver willing to learn with you, the process becomes easier. And, in many homes, that turns into something beautiful. A husband helps his wife. A daughter helps her father. A neighbor checks in weekly. This is not just technique. It can become care in action. Let me give you the simplest possible version of the full manual method now, from start to finish, because I want this fixed in your mind. Sit quietly for 5 minutes. Feet flat, back supported, arm at heart level on a table, bare upper arm, cuff 1 inch above the elbow, artery marker lined up correctly. Feel the pulse and inflate until it disappears. Deflate completely. Wait 30 to 60 seconds. Place the stethoscope over the brachial artery. Inflate to about 30 points above the estimated systolic. Release air slowly, about 2 millimeters per second. First sound is systolic. Last sound is diastolic. Write it down. Wait a minute. Repeat. And, that is the backbone of reliable manual measurement. But I don't want you to memorize steps like a robot. I want you to understand what the reading actually means. The cuff temporarily stops the flow. As the pressure falls, blood starts squeezing through again. That first tapping sound means the top pressure in your arteries is finally strong enough to push past the cuff. As the cuff loosens more, the flow becomes smoother. Then the sounds disappear. That point reflects the lower pressure when the heart relaxes between beats. Once you understand that, the reading stops feeling like magic. It becomes a physical event you are listening to in real time. And that understanding is what makes your confidence last. Let me tell you one last story, because this one brings the whole lesson home. Robert from Boise, Idaho, was 80 and fiercely independent. He didn't want to bother anyone, didn't want to make extra doctor visits, and didn't want to feel helpless around his health. Learning the manual method gave him something he had been quietly losing: trust in his own ability to monitor what was happening in his body. Was he perfect on day one? Not even close. He missed sounds. He pumped too high. He squeezed the stethoscope too hard. But after practice, he got consistent. And more than that, he got calm. He stopped reacting to every random number because he finally knew how to measure correctly. That calm matters more than most people realize, because blood pressure is not just a medical topic. It is emotional. It is tied to fear of stroke, fear of heart attack, fear of losing independence, fear of not knowing whether your body is safe today. A trustworthy reading gives you something precious, a solid piece of reality. Not panic, not guessing, not wishful thinking, reality. And when you have that, you and your doctor can make better decisions. You can notice true patterns. You can avoid false alarms. You can catch real problems sooner. Accurate measurement is not a small household skill. For many seniors, it becomes a form of protection. So if you remember nothing else from today, remember this: a good manual blood pressure reading is built on rest, position, correct cuff placement, a proper estimated systolic, slow deflation, and careful listening for the first and last sounds. If any one of those pieces falls apart, the number can fool you. If all of them come together, the number becomes powerful. And that power belongs in your hands, not just in a clinic. Learn it, practice it, respect it. And if this video helped make a complicated skill feel possible, share it with someone you love, because the right reading at the right moment can change far more than a number. Take Take care of yourself, keep your technique steady, and I'll see you in the next video.